Dear second year students, hello everywhere. Today we are going to discuss the muscles of the thorax. In order to study the muscles of the thorax, we have to know the skeletal framework which form the thoracic wall. First of all, this is a typical rib. This is the anterior end of the rib and this is posterior. Posterior, we will find head followed by neck and tubercle. Then the shaft that face outside or outward. Inside or from its inner surface, there is a costal groove area grooved in the inner surface of the rib, which allow the passage of the vascular and the nervous structure in the intercostal spaces. Costal groove. The groove has two lips, upper and the lower lip, and has a floor. Costal groove. Then, this is the angle of the rib, and which is formed by the shaft. Then, this anterior end is cup-shaped to allow the lodging of the costal cartilage. This is the costal cartilage of the rib. Okay, this is the sternum. The posterior surface of the sternum. As you know, the sternum is formed of three parts: manubrium sterni, body of the sternum, and D5 process. These are the ribs. They are connected to the side or the lateral side of the sternum by costal cartilages. The ribs that are connected to the sternum are called true ribs. This is rib number 1. This is rib number 2, and this is a very important landmark, anatomical landmark. Why? Because we can start counting the ribs from its side. This is the junction between the manubrium and the body. This joint is can be felt outside from the skin. So if we follow this joint, we will find that this is the second rib. So this is the second, third, fourth, fifth, sixth, and seventh. The seventh, with its costal cartilage, is the last rib to be connected to the sternum. Followed by the 8th, 9th, 10th, 11th, and 12th, where the costal cartilage will hook to catch the 7th costal cartilage and to be attached to the sternum. Okay, here is the full orientation of the bones forming the thoracic cavity or the thoracic wall. Posteriorly, these are the thoracic vertebrae. Okay, they articulate with the ribs by its posterior end. It articulates with two adjacent vertebrae. And if we follow anterior, we find the costal cartilage attached with its attachment to the lateral side of the sternum. So this is the thoracic wall or the thoracic cage, how it is formed. This diameter is said to be the anteroposterior diameter. Anteroposterior diameter. And this is the transverse diameter. So this is the transverse thoracic cavity diameter. This is the anteroposterior, from anterior to posterior, and this is the transverse. If we follow from up to down, this is the vertical diameter. Okay, vertical, transverse, anteroposterior. What are intercostal spaces? Intercostal spaces are the spaces between the adjacent ribs. This is the manubrium, as we said before. The first rib is attached to the manubrium sterni, so the first rib. Second, third, fourth, fifth, sixth, seventh, eighth, and ninth, and 10th. 11 and 12 are not appearing because they are floating ribs. How can we count the intercostal spaces? The space below the rib is its intercostal space. So this is the first intercostal, second intercostal space, third, fourth, fifth, sixth, 7th, 8th, 9th, and 10th. The 11th intercostal space is between the two floating ribs. It is short intercostal space, but it is present between the two floating ribs. So we have 11 intercostal space, 11 intercostal space, 11 pairs of intercostal spaces. Pairs means 11 on the right side and 11 on the left side. So this is the intercostal spaces. Intercostal spaces. Again, the intercostal spaces is the spaces that lie between adjacent ribs, and it is filled with intercostal muscles, muscle fiber that travel between the two adjacent ribs to fill this space. These muscles are called intercostal muscles. Intercostal muscles. As you know, any intercostal or any muscle have its own blood and nerve supply and venous drainage. So, in the intercostal spaces, there are structures that lie in the costal groove. Costal groove. You remember the costal groove? If this space, for example, is the fourth intercostal space, so the vascular or neurovascular plane of the fourth intercostal space run below the fourth rib. They are protected by the costal groove of the fourth rib. Again, this is the first rib, second, third, and this is the fourth rib. Where is the fourth intercostal space? Very good. This is the fourth intercostal space. The fourth intercostal space contains the intercostal muscle of the fourth intercostal space and the neurovascular bundle of the fourth intercostal space. They are protected by the costal groove of the fourth rib. So they are present in the inferior margin of the superior rib of their intercostal space. They pass and are protected by the two layers of muscle. This is one layer, and externally there is another layer. And the neurovascular bundle run between these two layers of muscle. Okay, so the costal groove protect the neurovascular bundle, and the muscles protect the neurovascular bundle. Again, if we can count, this is the first intercostal space, second, third, fourth, fifth, sixth, seventh, eighth, ninth, and 10th. Where is the 11? The 11 is between the floating ribs number 11 and 12. What is this space? This is called subcostal space, no longer intercostal because there is no lower rib. So the space below the 12th rib is called subcostal space, not intercostal space. And here we begin the abdomen. So this is the subcostal space. Muscles of the thorax. Today we are going to discuss the muscles of the thorax. Okay, let's start to study the intercostal muscles. Intercostal muscles. Intercostal muscles are divided into 3 layers. Outer layer is called external intercostal muscle. Do you remember the anterior abdominal wall, which was formed of 3 layers? External oblique, internal oblique, and transversus abdominis. This is the same. The 3 layers of the thorax, the first layer of the outer layer is called external intercostal. The second one is called internal intercostal. The third layer is divided into 3 layers. One occupies the most anterior part of the thorax, which is called transversus thoracicis or thoracis or sternocostales. The second part, or the muscle which occupies the posterior, is called subcostales muscle, and this muscle occupy or lie at the third layer of the layers of the thoracic wall and lies posterior, subcostal muscle or subcostales. At the middle part of the thoracic wall or the lateral part of the thoracic wall, the third layer is called innermost intercostal. Again, 3 layers: outer layer external intercostal, middle layer internal intercostal, and third layer. The third layer is not one sheet. It is divided. All of these 3 muscles lie in the same plane, but in different places. The innermost is lie in the middle of the thoracic wall, lateral side of the thoracic wall. Subcostal or subcostales lies near the posterior end of the thoracic wall on the plane of the third layer of muscles. Sternocostales lies anteriorly. It forms the third layer of the muscles of the thoracic wall anteriorly. Anterior, posterior, middle part of the thoracic wall. All of this form the third layer of the intercostal muscles. This is the second layer or the middle layer, and this is the outer layer or first layer, external intercostal muscles. We will start with external intercostal muscle. External intercostal muscle. How many external intercostal muscles do we have? We have 11 pairs. 11 pairs. As we said before, there are 11 intercostal spaces, the intercostal spaces pairs, 11 on the right side and 11 on the 12 on the left side. So each space will contain external intercostal. This is the first layer, the first muscle layer in the intercostal space, so it is called external because it lies external. While we are going to study the intercostal muscles, we have 2 items: extent and attachments. We have to know their extent and their attachment. The extent is from where this muscle begins and its direction of the running of its fibers till it ends. This is what is called extent. External intercostal extend from posterior and travel to anterior. External intercostal starts posterior near the tubercle of the rib. The tubercle of the rib lies posteriorly. From this plane, the fibers of the external intercostal arise to run in the space, in the intercostal space, to reach anterior. It runs from posterior to anterior. When it reaches anterior at the costo-chondral junction, they are replaced by a membrane, aponeurosis. So this white area is now called anterior or external intercostal membrane, anterior, because the muscle fibers are replaced anteriorly by the anterior intercostal membrane. So, if we follow this muscle, it starts posteriorly from the tubercle, run in the intercostal space to reach anteriorly. When it reaches to the costochondral junction, it is a change in its nature, become aponeuroses or fibers to form membrane, not fleshy fibers. This membrane is called anterior external or anterior intercostal membrane. Anterior intercostal membrane. Okay, this is the extension. The attachment. The attachment, it is attached to a bone up and a bone down, a rib above and a rib down. Where exactly? If you know, the ribs are formed of two borders, upper border, lower border. The upper border is rounded and the lower border is sharp, like a knife. It is sharp. So if we are going to study the rib, the upper border is rounded while the lower is sharp. The external intercostal, it is attached to the lower sharp border of the rib above and the round border of the rib below. Again, it is attached superiorly to the rib above, where at its sharp lower border, and it is attached, or in the insertion of this muscle is in the upper border or the round border of the rib below. So in the exam, practical exam, if we mark the upper border or the round border of the rib, this is the attachment of the external intercostal muscle, the insertion of the external intercostal muscle. If we mark the lower sharp border of the rib, this is the origin of the internal intercostal muscle of the space below. Again, if this is the first rib, second, third, fourth, and this is the fifth rib, the lower border of the fourth rib will give rise to external intercostal muscle, so it's a sharp border. And the fifth rib will give attachment or insertion of the external intercostal muscle of the space above, of the fourth intercostal space. Is it clear? Again, extension from posterior to anterior. Anteriorly, it will change to external or anterior intercostal membrane, become membranous in form, not fleshy in form. And its attachment, a rib above, rib below, rib above through its lower sharp border, rib below by its rounded border below. The direction of fibers. The direction of fibers are very important as they help the action of the muscle. They extend from posterior to anterior, so they run forward from posterior to anterior, so they are going to anterior, so the fibers running anterior or forward. Downward, because they arise from the rib above and inserted to the rib below. Arise from the rib above and inserted in the rib below. Arise from posterior, go and run to anterior, so the direction of fibers is downward and forward, downward and forward. If this muscle will act, it will lead to raise of the rib. It will elevate the ribs. Elevation of the ribs is very important in inspiration. Inspiration, not expiration. Inspiration. So the internal, the external intercostal muscle helps in inspiration. Why? Because of its direction. Their direction are coming from backward, downward. This leads to elevation of the ribs. Elevation of the ribs is used in inspiration. Okay. This is the second layer of the muscles. This is the internal intercostal muscle. Internal intercostal muscle. Can you see behind the internal intercostal muscle the vein, artery, nerves run by this arrangement in the costal groove? The vein is the most upper part and the artery is in the middle. Nerve is the most below. Vein run in the costal groove between two planes, the internal intercostal outside and the innermost layer inside. The external intercostal, internal intercostal, followed by the third layer, which is the innermost. Between the two layers run the vein artery nerve in the costal groove. Can you see the direction of fibers? The external intercostal are downward and forward. If we look to the internal intercostal and the innermost, we will find them in an opposite direction. They lie perpendicular to it in their direction. So they run backward, backward, and downward, backward, and downward. This means they will arise from anterior and run posterior, downward and backward, downward and backward. So their action is opposite to the action of the external intercostal. They will help in expiration, not inspiration. They will help to depress. They will depress the ribs, and this is used in expiration. Today we are going to discuss the muscles of the thorax. The next muscle is innermost intercostal muscle. Innermost means the most internal intercostal muscle, the third layer of the intercostal muscles. It was said that it was a part of the internal intercostal and they are splitted by the neurovascular plane. So they have the same direction, downward and backward, downward and backward, like internal intercostal. They are the third layer, but they don't occupy the whole wall of the thorax. They occupy only the lateral side of the thorax, the middle two-fourths of the intercostal space. How? If we divide the rib into 4 quadrants, first quadrant anterior, second quadrant and the third quadrant in the middle, and the fourth quadrant near posterior, near the vertebrae. It will just occupy the middle two-fourths, not the whole, not from anterior to posterior, only at the middle part of the thorax. Okay, it is attached to a rib above and rib below. The rib below is the upper border of the rib below. Where at the upper rib? The upper lip, it will be connected to the upper border or the upper lip of the costal groove of one rib above. So, if this is the fourth intercostal space, this is rib number 4 and this is rib number 5, it will be attached to the upper lip of costal groove of rib number 4. So, it is in a higher position than the internal intercostal. External intercostal, just the inferior border. Internal intercostal, floor of the costal groove. Innermost, at the upper lip of the costal groove. As we said before, that both muscles are split to enclose the neurovascular bundle, intercostal vein, intercostal artery, and intercostal nerve. And this is their arrangement, or they run in this arrangement: vein the most superior, artery in the middle, and the nerve below. Vein, artery, nerve are separated by or are enclosed by the internal intercostal from outside and the innermost intercostal from inside. As we said, the direction of fibers is downward and backward. So, the innermost intercostal muscles are related internally to the endothoracic fascia, because we are going to the thoracic fascia, the fascia that surround the lung, and the parietal pleura, the pleura that connect or cover the lung, and externally to the internal intercostal. The internal intercostal, then the internal intercostal muscles come after this. This is a transverse section to see the arrangements of the muscle. The first layer or the first red layer is external intercostal. The second one is internal intercostal. Then there is a very fine layer, the innermost. Its color is orange in the diagram. If you look carefully, you will find a fiber, a nerve fiber, neurovascular plane that run between the red layer, which was the internal intercostal, and the orange layer, which is the innermost. So it is related to the outside, the innermost related externally to the innermost, then the internal intercostal. Internally, it is related. This is the two lungs and the mediastinum. These blue lines are the pleura covering the lungs. The outer pleura is called the parietal, and the pleura lining the lung is called visceral pleura. The endothoracic fascia is between the parietal pleura and the muscle layer. So, the innermost intercostal is related internally to the endothoracic fascia and the parietal pleura of the lung. Okay, let's move to another muscle, which is subcostal muscle or subcostales. Subcostal, sub means below, costal means ribs. This muscle connects ribs, but in a special way. How? They are present in the plane of the third layer of muscles. The first layer is external, the second layer is internal, the third layer is divided into three parts. The most posterior part of this layer is present near the posterior part of the thorax, near the vertebral column. It is called subcostal muscle. It arises from one rib and jump or pass 2 or 3 spaces and ribs to be inserted in a lower ribs 2 or 3 ribs below. So it is present in the posterior part of the chest wall, and it is more developed in the lower part of the chest. They are present in the lower and the posterior part of the thorax. They arise from one rib, jump. They are not connecting the adjacent ribs. They jump or pass 1 or 2 ribs or 1 or 2 spaces to descend to be inserted into 2 or 3 ribs below. This is the extension. Attachment. It is attached to the internal surface of one rib to the internal surface of 2 or 3 ribs below. Okay? Internal surface with internal surface. Internal surface to internal surface. The direction is downward and backward. Downward and backward. They arise more laterally and descend more medially. So they are the direction of their fibers downward and backward. Downward and backward. Another muscle called transversus thoracis. Transversus thoracis, by its name, it will transverse the thoracic wall. The other equivalent name is called sternocostales, as we said before. Sterno for sternum, costalis for the ribs. This diagram shows the sternum from its posterior view and the inner surfaces of the ribs, as if we are looking from the internal view to the thoracic cage. This is the posterior view of the sternum and the corresponding adjacent ribs. They arise from the lower part of the body of the sternum, from the internal surface of the back of the sternum, the posterior part of the body of the sternum, posterior part of the body of the sternum. So this muscle is developed or is present in the anterior part of the chest wall. As we said before, the muscle layers are divided into 3 layers. The outer one, sternal, the middle one, internal, and the third plane is divided into 3 muscles. One near the posterior, which was subcostalis muscle, the previous muscle as we just mentioned, and anteriorly transverse thoracis or sternocostalis, and at the lateral wall, at the angle and the curve of the ribs, these are the innermost muscles, the innermost intercostal muscles. Again, transverse thoracis arise from the inner surface of the sternum, back of the sternum, lower part of the sternum, and arise by many digitation by 5 slips to be inserted into the lower border of the costal cartilage from the 2nd to 6th. Here is the sternum, 5 slips. This is the manubrium, so the first one is the first rib, 2nd, 3rd, 4th, and 5th. First slip, 2nd slip, 3rd and 4th slip. So they run transversely, upward to reach a higher level or the higher ribs, they arise, so the direction of fibers is upward, and laterally because they arise from the sternum and go to be inserted into the back of the costal cartilage of the lower from 2 to 6 costal cartilage. They are well developed or present in the internal surface of the anterior part, as we said, anterior part of the thoracic wall. Nerve supply of the intercostal muscle. All these muscles are supplied by adjacent intercostal nerve. As you know that the intercostal nerve runs in the intercostal groove or the costal groove in the arrangement of vein, artery, nerve. So this nerve, this thoracic nerve, as each nerve or each segment will supply each intercostal space. So they are supplied by adjacent intercostal nerves. Action of the muscles of the thorax. Almost we mentioned all of them. The external intercostal was the elevator of the rib due to its fiber and its direction, downward and forward. So they are elevator. The ribs elevate during inspiration. The internal and the innermost, they were in opposite direction, so they depress the ribs. Depressing ribs is required in active expiration. Active expiration because they depress the rib. Subcostal depress the rib. So the only elevator of the ribs is the external intercostal thanks to the muscle fiber direction. Transversus thoraces, do you remember? They arise from the sternum and walk laterally and upward to be inserted in the costal cartilage. So they depress the costal cartilage to which they are attached because they arise from the internal surface of the sternum to the costal cartilage. So they draw down the costal cartilage. All the muscle of the intercostal spaces support the intercostal spaces from preventing them to come out and in during the inspiration. What does this mean? Can you imagine if these two spaces are not filled with muscle? During inspiration and expiration, with the change of the pressure inside the thoracic cavity, if the pressure increases, the thoracic cavity will bulge through these spaces. And if the pressure decreases, like in expiration, the thoracic cavity will be pulled inside. So this is prevented by the intercostal muscle to keep the intercostal spaces and structure in the thorax in its place to prevent the bulging outside. Okay. Muscles of respiration. At first, we have to know that respiration is divided into two phases. Inspiration means that the air comes into the thoracic cavity. During the inspiration, it is a process by which all the thoracic cavity capacity will increase to draw more air inside the chest or inside the thoracic cavity. So during inspiration, all the diameters will increase to increase the capacity of the thoracic cavity. The opposite occurs during expiration. The air comes out. Air comes out by the decrease of the capacity of the thoracic wall. No space for the air to be inside, so it will come out. This occurs during expiration. During inspiration, the diaphragm is the major muscle, is a chief muscle. It is said that the diaphragm is the chief muscle of inspiration. By the contraction of the diaphragm, when the diaphragm contracts, it descends. Can you see this arrow? It descends downward. This means contraction of the diaphragm. When the diaphragm contracts, it comes or moves downward. When it moves downward, it increases the vertical diameter. As we said, in inspiration, we have to increase all the diameters, so the vertical diameter is increased by the inspiration or by the contraction of diaphragm, so the vertical diameter increase. Elevation of the diaphragm occurs when the diaphragm relaxes, push up or moves up to push the thoracic cavity, and at this time the air come out. Okay, so elevation and depression of diaphragm, it changes the vertical diameter of the thorax. Inspiration is divided into two types. Quiet inspiration, like that we take all of the time. Quiet, not in purpose, like that we are going to sleep. Quiet, very easy, not with effort, not on purpose. This is called quiet inspiration. During this inspiration, all diameter of the thoracic cavity will increase, as we said before. The transverse diameter, this is the transverse diameter, and this is the vertical diameter, and this is the anteroposterior diameter. Do you remember? We said that at the beginning of the lecture. The anteroposterior diameter is the line between the vertebral column and the sternum, transverse diameter between the ribs, and the vertical. As we said before, the vertical diameter increased by the contraction of diaphragm and its descent. This arrow shows the descent of the diaphragm by its contraction. The normal color, this color of the skeleton or the framework, is the normal position of the thoracic cavity. Can you see this color? This color represents the movement that is made by the sternum and the ribs during inspiration. Both are moved by two mechanisms, one called the bucket handle movement and the other called the pump handle movement. In order to understand the pump handle movement, this occurs because the anterior end of the ribs are inferior, much more inferior, are in a lower position than the posterior end. The posterior end are more higher, the anterior end are lower. So, when the rib is elevated, they move the sternum forward, and upward, By this movement, it is called pump handle movement. And this will alter or change or increase the anteroposterior diameter of the thorax. So, the pump handle movement increase the anteroposterior diameter. Okay, the opposite will occur when the rib depresses. When the rib depresses, the sternum moves downward and backward, and this will decrease the anteroposterior diameter. Type. The transverse diameter is increased by a mechanism called bucket handle movement. You know this bucket of water? Bucket handle movement. This is because the middle of the shaft of the ribs is lower than the two ends. The middle of the shaft, normally the middle of the shaft is lower in position than the two ends. So, when the shaft is elevated, the middle shaft will move laterally, moves to outside, because normally the shaft or the middle part of the shaft is at the lower position than the two ends, the two hands of the bucket. So when the rib is elevated by, for example, external intercostal, the handle bucket or the bucket handle will move the upside, move to up, elevated and laterally. and this will cause the lateral or the transverse diameter of the thorax to increase. This occurs normally during inspiration. Nerve supply of the intercostal muscle. All these muscles are supplied by adjacent intercostal nerve. As you know that the intercostal nerve runs in the intercostal groove or the costal groove in the arrangement of vein, artery, nerve. So this nerve, this thoracic nerve, as each nerve or each segment will supply each intercostal space. So they are supplied by adjacent intercostal nerves. Action of the muscles of the thorax. Almost we mentioned all of them. The external intercostal was the elevator of the rib due to its fiber and its direction, downward and forward. So they are elevator. The ribs elevate during inspiration. The internal and the innermost, they were in opposite direction, so they depress the ribs. Depressing ribs is required in active expiration. Active expiration because they depress the rib. Subcostal depress the rib. So the only elevator of the ribs is the external intercostal thanks to the muscle fiber direction. Transversus thoraces, do you remember? They arise from the sternum and walk laterally and upward to be inserted in the costal cartilage. So they depress the costal cartilage to which they are attached because they arise from the internal surface of the sternum to the costal cartilage. So they. The next muscle is innermost intercostal muscle. Innermost means the most internal intercostal muscle, the third layer of the intercostal muscles. It was said that it was a part of the internal intercostal and they are splitted by the neurovascular plane. So they have the same direction, downward and backward, like internal intercostal. They are the third layer, but they don't occupy the whole wall of the thorax. They occupy only the lateral side of the thorax, the middle 2/4 of the intercostal space. How? If we divide the rib into 4 quadrants, first quadrant anterior, second quadrant and the third quadrant in the middle, and the fourth quadrant near posterior, near the vertebrae. It will just occupy the middle 2/4, not the whole. Hope this was easy. Thank you for listening. Waiting for your feedback and the question on my email. Till we meet again, thank you, dear students.